As healthcare assistant worker, you must not work in a home. What I mean by in a home is where old people live. There are so many places that you can work as a healthcare assistant worker. You can work in a hospital to take care of patients. You can work in a private house to take care of disabled people, like people that are not normal. You can work in a private home to take care of.
Hello guys, welcome back to my channel. If you are new here, you're welcome. For my old subscribers, you are welcome. Okay, in today's video I'll be talking about healthcare assistant work. Yes, healthcare assistant work. You know, in other countries like UK, US, Canada, those countries, healthcare assistant work is a very lucrative work for immigrants and other people in the country. But coming to Switzerland, yes, it is, but it's a kind of hard to get the work. Yes, because of what? The reason is because there is a language barrier. Yes, there is a language barrier, and there are some certain stages you must pass before you get a healthcare assistant work in Switzerland. It's not that easy to get a healthcare assistant work in Switzerland. Before making the video, I thought of it because me too, I would like to work as healthcare assistant in a hospital or any place in a home or private or anywhere. But coming to think of it, coming to Switzerland, you don't know their language. Yes. And there are some certain trainings you need to go through before getting that work. Unless you get a sponsorship work visa that will grant you immediate work when you arrive in Switzerland. But getting that work sponsorship visa is not that easy. The reason is that those that work or want people to work in their home or in a hospital, considered so many people don't speak, so many, like if you get the work in the home, so many old people, they don't speak English. So many of them speak their maternal tongue, as in be it French, Italian, and German, or whatsoever. It's just few old people that can comprehend English, those who are immigrants. But those that are from Switzerland, they don't understand any other language than their maternal tongue. So they would like someone that understand and speak very well to have the work. Number one is for you to understand what your patient is telling you. When the person is complaining of headache, pain, or anything, or when the person wants you to get something for him or her, for you to understand that this is what the person needs. So in order to get the work, you need to go through some trainings. You need to, for me, I will say that the easiest way to learn language is to start working. You must not go straight, find the particular work you want at that particular time, unless you are from a country that they speak same language with the place you are in Swiss right now. It won't be a problem. It won't be a problem. The only problem you might have is experience, of which you can go through it or find a way of going through it. But the most importantly, what they consider most is, do you speak language? Do you have experience? Experience is not much, although it is, but once you go through the training, the right processes, going to Red Cross to acquire the how do I put it, the right what's this word, training for the work, Red Cross will issue the certificate that you are certified to work as a healthcare assistant. But before then, if you don't speak, I don't think you can be able to get the work, because your clients need to understand, need to communicate. Okay, need to communicate, and you need to understand. So it's not just what you just come, you snap your finger and you get the work. Get any work that is available at the time when you arrive. If you don't speak any of the language, French, Italian, Dutch, or any other, get any work. From there you learn small. If you have the money, you register yourself in a school to learn the language. It helps a lot. From there you take it up, you go to Red Cross, do the necessary training, go through all the necessary procedure that is needed. From there you get your experience. And mind you, if you are working as a healthcare assistant, I think there is more chance for you in future if you want to migrate to a nursing, to being a nurse or other healthcare. Because me, the reason why I want to do a healthcare work here in Switzerland is for me to get more experience. Because back then in Nigeria, I studied microbiology. But coming to Switzerland as a graduate, I cannot use my certificate because I need to modelize it to Switzerland standard. So for you to step up or start making a move to get to your desired career or working in your, how do I put it, in the career that you have already studied, you need to start from step one to when you get there. Although I like nursing, but you cannot just come and start working as a nurse in Switzerland. It's not done that way. You must go through some processes, and if by the grace of God you passed or you pass the procedure, you can be chosen to work in a hospital. But in this healthcare of a thing, like other country is not very difficult, because other English speaking country, because they speak English. The only thing you need to do is to just go through some trainings, maybe 1 week, 2 weeks, or 1 month training, you are good to go. But here in Switzerland, you must start from zero so that you can be able to get what you want. And going to Red Cross for training, they don't, I don't think that the course they offer it in other languages except their maternal language, French, German, or Italian. So it will be the kind of difficult for someone that doesn't understand A or B to start going for training, Red Cross training, or other department that can offer you those training, because you need to understand how to read and write before going for the training. So it's very difficult for you to know that you can't just come to Switzerland and you get a healthcare assistant work in Switzerland. It's a kind of difficult. but not all that difficult if you concentrate and put your mind on it. If you are a go-getter, you can get it. You can do it. There's so many other people that have been here, they go through it, and later they get their work and start making their end. And do you know one thing about it? They pay very well in Switzerland. Yes, they pay very well. They pay very well. So considering the time that you have wasted, once you start the work, you would laugh last. You will laugh last. So I decided to make this video because so many people think that when they come here in Switzerland, they will just get the work. No, it's not done that way. You have to go through some processes, make some necessary, go through some necessary information, course information or whatever. Do it before getting that particular work. I hope this video help you a lot in getting your dream work as health science or healthcare assistant in Switzerland. Thank you very much for watching. I love you all. Take care. Bye.